My name is Aaron Mascagnana. I'm a licensed clinical social worker here at Grease Chemical Dependency as part of Rochester Regional Health. I think the fact that we have an opportunity as an organization and as a community to really emphasize and prioritize recovery as a theme, I think is paramount. I think it's, a wonderful opportunity just to showcase not just what, a pandemic addiction has become, but really that we have the opportunity to bring healing to it and to bring awareness to it. There's been such stigma for decades around behavioral health issues such as addiction and mental health. And to bring it into a positive light, I think is just so important. And the fact that we've been able to celebrate multiple years in showcasing how recovery is a beautiful process and a beautiful path in people's lives. And, from the stories that we hear every day to the stories that are showcased in testimonials, it just brings a wonderful light to what's been a very dark topic for many decades. The trauma program, it goes by the acronym STEP, and we started this program back in the late spring, early summer, as just another comprehensive look at how we treat addiction, really. It's been a passion of mine for several years, and I just recently had the opportunity to go through some specific trauma therapy training, and it's always been a vision of mine to bring that back to this program. It was something that we were addressing several years ago when I first started at Unity back in 2016, and it was something that we lost, and so I was really sad to see that go. And so just recently I was able to be trained in a specialized type of trauma therapy called EMDR, and it helps address issues of trauma. And so how we apply it is focusing on negative beliefs that have been attached to people throughout their lives, but predominantly through adverse childhood experiences or trauma, and looking at how that's influenced how they've developed these issues with addiction. And we often see that these issues become really difficult to shake, really difficult to work through, and we use these new interventions such as EMDR and other treatment modalities to help patients better understand themselves and help, release themselves from these past negative experiences that continue to hold them prisoners in their own mind. The biggest reason I'm so passionate about this program is because I've been in the field for a decade now as far as behavioral health is concerned. And one of the things that I've just noticed time and time again is, as a community, sometimes get narrow-minded and really a tunnel vision into just symptoms of the addiction. We talk a lot about relapse prevention, we talk a lot about cravings and triggers, and the things on the surface that really impact our people that we're working with. And it goes so much deeper than that. And that's always been a passion of mine, to help clients and the people that I work with understand what's really at the root of this. And a lot of times it is trauma. And I've always been passionate about really challenging myself to work on the most complex issues that the people that struggle with addiction and trauma face. And so we developed this program, STEP, which stands for Seeing Through Ending Pain. And it's this idea that we want to release them from pain of the past, understanding that we can't prevent them from future pain, but at least to release them from past wounds can set them up for a much better future.